Good day, ladies and gentlemen. This is Watson Michael from Ceylon Institute of English and Leadership, and welcome to our second episode of Health is Wealth, the importance of nutrients. And we have Dr. Robert Adams, also known as Dr. Bob, with us, a retired Navy SEAL commander, a retired Delta Force colonel, now a family physician, international best-selling author of 3 books, which are sold in over 20 countries. And I always say this, he became a doctor of medicine at the age of 40, right? So I don't think I can do that. Okay, so he belongs into the special elite people like David Goggins and so many more, right? So Dr. Bob, welcome back. How are you doing today?
Thank you. It's always a delight to be talking with you. It's morning there and it's night here, but it's still fun.
Absolutely. So the best part about technology, right? So talk about these days we see many various ailments around the world. So due to their lifestyle and food habits. So what are the main reasons that people get diabetes?
That's a great question because it's becoming a worldwide epidemic.
Mm-hmm.
In America, we are all fat. Statistically speaking, we can't find people to join the military because they're overweight, and
Mm-hmm.
type 2 diabetes is from
Okay.
food. Type
Okay.
1 diabetes is caused worldwide by certain viruses
Okay.
that infect children at very young ages, 2 months, 3 months old, 3 years, 4 years old, and they get a type 1 diabetes because their immune system overreacts to the
Mm-hmm.
virus infection. And that has a very slight family inheritance attached to it if you have the right kind of tissue genetically, and you get exposed to the right virus, you can end up with a child with type 1 diabetes. They will never make insulin again. They chew up the pancreas, and those cells that make insulin don't work anymore. So these are children that have to stay on insulin for the rest of their lives, and diet has very little to do with how well they do. They don't get fat. Most type 1 diabetics remain thin, and they're hungry and have to take insulin, and they become a problem when they're turned teenagers because they're mad at the world that it happened. But the rest of the world, the large majority of people that suffer from diabetes do it because they eat the wrong foods and drink the wrong drinks. And every country has Pepsi Cola and Coca-Cola and sweet teas. When I was in Iraq for breakfast, they would give me bread with whipped cream and this sugary tea. That was like, wow, if you drink much of this, you're going to give me diabetes. And they said, no, we like our sugar. And we do in the United States, and in the southern United States, below what we call our Mason-Dixie line, they serve huge portions of sweet tea at all of the fast food restaurants. And so, you'll get a gallon jug of sweet tea and go to breakfast with it, and a gallon jug at lunchtime. And it's not just tea that you mix sugar in. In order to make this tea, they have to super saturate it. They have to heat up the tea, add extra sugar, let it cool down so that it holds the most amount of sugar possible. And of course, in most countries have fast food now. Krispy Kreme donuts is very popular in the southern United States, and that's just bread and sugar, and you drink it with your sweet tea. We have cupcake stores that have cakes with big thick icings on it. California, which is our healthy western part of the world, doesn't have some of the restaurants we have down south. We have something here called Biscuitville, and all they serve is big thick southern biscuits, and you stuff them with honey and bread and whatever you want, sausage and eggs, and it's a tourist attraction for people from north and west. They come here and go, can't believe these people are eating this. As a result, we have a lot more diabetes where these types of foods are served. So number one is Coca-Cola's, Pepsi's, sweet sodas. And then number two are products made from wheat. You know, corns and oats are much better digested. They don't
Mhm.
get converted to sugar as easily. One of the, if you ever want to do an experiment on yourself, put a piece of bread, wheat bread, in your mouth and chew it for a while. It'll turn sweet in your mouth, and that's because spit, saliva, is converting the bread into sugar. So that
Mm.
so those are the leading two causes: bread and sugar. And then the second one is, you know, becoming overweight. Your fat
Yeah.
actually produces hormones that make you hungry, makes you want to eat more.
Mhm.
And so what comes with that is high blood pressure and high sugars, and, you know, all the diseases and discomforts associated with that, because it damages your nerves. Your feet and fingers start to go numb. You
Wow.
balance. It's a very, very tough disease, and one
Mhm.
that every doctor worldwide, you know, hates.
Yeah. Wow. Very interesting. So, I never had Coca-Cola or Pepsi since 2016, right? So it's 8 years now.
Good, good.
Great. So, could you let us know, Dr. Bob, what are the main reasons for high blood pressure and, interestingly, low blood sugar?
Yeah, that's the diabetes connection too. If
Wow.
you
Okay.
gain weight, your blood pressure goes up. If you don't exercise and keep your heart and muscles strong, your blood pressure goes up because you're not eliminating some of the harmful ingredients that's in our food and our food coloring. That
Mhm.
comes out in our sweat and in our tears. And the if you think about this, if you gain 10 pounds of weight, your blood pressure on that top number goes up about 10 points. So when people come to me, diabetic, 250 pounds, you know, what do I do about my sugars? Give me a pill. I go, well, I'm going to give you a pill, but you don't have to be a diabetic. I tell people all the time, diabetes is a disease of choice when you catch it early, because you can stop eating, lose weight, and get rid of your diabetes.
Wow.
Yeah, but you got to catch it early, and you got to reverse before the high sugars cause damages to your pancreas.
Wow.
Now, and what other thing you talk about low sugars, and
Yes.
I wanted you to bring that up because in managing a diabetic, a doctor has to pay attention to average blood sugars, because it's going to go down while you sleep, because you're
Mhm.
not and as soon as you wake up, you get a resurgence of everything turning itself on, and blood sugars will drop suddenly.
Mhm.
It has a fancy name called the Somogyi effect, named after Dr. Somogyi, who discovered it. And if you
Huh?
bring sugars down too low with medications, when
Okay.
you wake up, you first get out of bed, you fall down and
Okay.
break. We don't like that very much. So the management of diabetes tries to keep the blood sugars higher than normal. When you
Mhm.
have diabetes, low blood sugars are more dangerous than high blood sugars, because that's when you fall down the stairs, break your hip, you know, get a hip replacement, blood clot, pneumonia, and die. So,
My
and
God.
that's particularly true in the elderly. I work very, very hard to
Mhm.
get my people to understand that they don't want their sugars to be normal. Because in your 60s, 70s, and 80s, by now the ability of the pancreas to do the insulin work on its own has burned out. And so we're never going to be able to get you back to normal with just diet alone. We'll get you to a management level with exercise and diet. But, you know, many patients over the years said, oh, you know, I want my sugars to be under 100.
Yeah.
And yep. I said, no, please don't do that. Not at your age, not with diabetes, because literally your blood sugars get low. And this is interesting, a little bit of
Mhm.
nutrition facts. The
Uh-huh.
only chemical that you eat that the brain can use for
Yeah.
food, it can't use protein and it can't use fat. So
Okay.
everything in the body's digestive system is converted by digestion into sugar. So
Mm-hmm.
the brain is the control point.
Yes.
So when you don't get enough sugar,
Mm-hmm.
it goes, I can't do my job anymore. And that's when you fall down and drive your car into a tree, and
Yeah.
bad things come of it.
Wow. I mean, that's very interesting, actually. Yeah. But Dr. Bob, like this low blood sugar can be treated properly, right, with the correct food and the diets?
Yeah, most diabetics know to carry candy with them for just that very reason. If you're taking medicines or insulin or even the pills and suddenly start sweating and feeling shaky and lightheaded, most people know to pop some sugar in there because the brain has run out of its only food, and sugar is rapidly absorbed, and so they come back. But it's literally, you don't want to be driving a car when your sugars are low or your blood pressure is too low, and both of these can happen if you're not paying attention. Like you asked me earlier about skipping meals. Can I just have my tea and coffee in the morning?
Mm-hmm.
Well, sure, you and I can't. Well, most people, if they're not taking medications, can have one meal a day if they want. Very healthy, no problem.
Mm-hmm.
Because we're going to use our stored fats and we're going to make sugar, and I'll keep our brain happy.
Okay.
But if you're physically active, or if you're on medications, or you're not getting enough complex food that takes a while to digest,
Yeah.
and by that, complex carbohydrates, meats, fats, proteins. The body has a long process to turn fats and protein to sugar.
Yeah.
And so you don't suddenly run out. So perfectly okay to have coffee for breakfast. I do it all the time. Have my black coffee in the morning, run off to work. And then about 10:30 in the morning, I'm going, okay, I should eat something.
Yeah.
But it doesn't hurt you. It doesn't make you more prone to diabetes, for example.
Okay. Wow, interesting. Interesting insight. Right. So the next one which we wanted to ask you was like what is a nutritional imbalance, and why are nutritious diets important?
So this is my all-time favorite question, but I'm looking at my notes, and I forgot to tell you something.
Sure.
Our country originally were American Indians, excuse me. And when the Americans settled America and were trying to get the Indians to be like us, we would tell them, well, we have breakfast at 6, we have lunch at 12, we have dinner at 6. And the Indians would look at us and go, white men, very strange. You eat, we eat by stomach, when we're hungry. And I mentioned that because, I read a story about an Indian back in the 1800s trying to explain to white people why, you're not smart about how you eat. And they're absolutely correct. You didn't see very many fat Indians. And A, they were very, very active, and B, they weren't eating bad foods, and C, they ate a little bit of something periodically during the day. Keep a little punch with them and eat some dried meat or some berries or something called pemmican, which is fats and berries mixed together. And they didn't have a diabetes problem because they didn't eat by their clock.
Yeah. Wow.
So here now, so the question you just asked me, because this is my favorite one. A lot of people have no idea, living in a world where refrigeration allows them to, buy a tomato any day of the week and pick up some corn and, get a banana. It's the vitamins and the nutrients are there.
Yeah.
People in the modern world that have nutritional deficiencies do it to themselves. For example, vegetarians become vitamin B12 deficient because there's not a lot of vitamin B12 in a vegetable, and that creates nerve problems, strength problems, neuropathy, we call it. And they'll come and go, I don't understand why, I'm so tired. Well, and we have, and we can't take B12 pills because the pills don't digest. So we have to give shots. So we'll give people shots. And the same thing happens with foods that you eat that make your B12 go away.
Mm.
Most
Okay.
common one, alcohol. People who drink alcohol every day should supplement their diets with high B12 foods or give themselves B12 shots.
Yeah.
The other way you can absorb vitamin B is under the tongue because it
Okay.
absorbs its membranes. And
Wow.
and my wife likes her wine with dinner, so she puts vitamin B12 under her tongue in the morning, and we're good. But so either foods make it go away, or you choose to eat foods that don't have it, and now you're in trouble. Now you get diseases. Now, the B vitamins are fascinating, and I'll stay on that B theme because there's a disease almost non-existent in the world today called beriberi, BERI, and it's a vitamin B1 or thiamine deficiency.
Okay.
And it only exists now in the poorest countries.
Okay.
And sadly, there's millions and millions of people living in the poor countries.
Mm-hmm.
We discovered it first in your home country, then called Ceylon, when in 1790, a British doctor said, all these people are sick, and I don't know why. And they called it beriberi and believed that it was nutritional, but discovered it people who primarily had rice as their only food source.
Okay.
And back in the early 1700s, early 1800s, later 1700s, early 1800s, people were using machines to get the chaff off the rice, and a lot of the vitamins were in that chaff. And so when you ate polished rice, you ate food, calories without any B vitamins. Wow. And so as soon as they discovered it in Ceylon, they discovered it in southern India, where the British were invaders. And then they said, well, if it's due to rice, and it's probably in China. Sure enough, in China and Japan. And it took almost 100 years to figure out that this was a vitamin called thiamine and to get it back into people's diets, because doctors were just intuitively saying, eat a different diet, eat better food, eat some meat, eat some vegetables. And the people that did that got better. Beriberi went away. And it's like, oh my goodness. The B2, which is a vitamin called riboflavin, I first discovered when I started treating patients, women primarily, with migraine headaches.
Okay.
And B2 or thiamine, if you give it to people with migraines, who usually have low blood pressure, by the way.
Okay. Wow.
Increase blood pressure a little bit, and it makes migraines much, much better. And you know, when we started breaking down the B vitamins, we discovered this and said, wow. So I give all of my migraine patients advice to eat more salmon, more eggs, more meat, and B12. The organ meats are very high in the B vitamins. A lot of people don't like to eat liver, but you know, but it's out there, and it's very high in natural vitamins.
Wow.
So those are sort of the key B vitamins that cause disease. Next letter in the alphabet is C. And those same British doctors that were sailing their boats back and forth between Ceylon and southern India were called lime, because they ate limes and they put it in their rum drinks.
Okay.
Which I was looking it up just today. The dark and stormy drink is rum and lime and ginger ale.
Okay.
And, ginger is good for nausea on a ship, and lime is scurvy. And you know, the sailors were having their teeth fall out and their skins were getting pale. And then somebody figured out that they weren't getting any citrus fruit in their diet. And so the Navy ordered everybody to go to sea with bags of limes. And all the sailors got a ration of rum and a ration of lime, and vitamin C deficiency went away, which I always thought.
Wow.
And I think you and I talked once before about micronutrients, like iodine causes thyroid problems if you don't get enough of it. And those explorers that were learning from the Indians to eat when they were hungry settled the Great Salt Lake and started growing big goiters in their thyroids because they weren't getting any iodine from seafood that couldn't get to the Middle West because there was no refrigeration. So the United States government, in its wisdom, and a lot of the world followed suit, started putting iodine in our salt.
Okay.
So there's a reason you get salt with iodine in it.
Yeah.
It doesn't make it taste better. It's just there because of your thyroid, and not everybody, is in places where there's a lot of seafood available high in natural iodine.
Mm.
And speaking of what governments do to make food solve disease problems,
Uh-huh.
the northwest part of the United States,
Yeah.
Washington, Oregon,
Uh-huh.
it is cloudy all the time, kind of like London.
Okay.
So certain times of the year, there's no sunshine.
Okay.
And so the children started to develop bow legs, bent bones,
Oh.
and a disease called rickets. And rickets is caused by vitamin D deficiency, which you
Uh-huh.
get from sunshine. So, and since there was no sunshine, the government decided we're going to use food to help these babies. And
Yeah.
so they started putting vitamin D into milk,
Wow.
because the American politicians said, and doctors, babies drink milk, we'll put vitamin D in the milk. And there's still
Yeah.
vitamin D in milk to this day,
Yeah.
so that they don't get rickets.
Yeah.
What we forgot back in the 1800s
Mm-hmm.
was that half of the world's population doesn't drink milk.
Mm.
If
Yeah.
come from Africa, where you never raised cows for food or drank milk as a supplement, you
Yeah.
don't have a digestive enzyme in your stomach to allow you to digest the milk. So they
Yeah.
don't drink it. So,
Yeah.
so they didn't get the vitamin D. And our American
Correct.
Indians and our Eskimos, very, very low on vitamin D. Dark pigmented skins have to be in the sun a long time. So we finally figured out to tell people, go get some sunshine and, find foods with vitamin D or supplement with vitamin D so you don't get rickets.
Wow. That's very good. I mean, excellent
And
insight.
I forgot the first letter in the alphabet. This is my supplement. My most favorite supplement is vitamin A.
Okay.
As I was telling you before we went live today,
Mm-hmm.
I was surprised to discover that 250,000 to 500,000 children every year are going blind, even now, even today, because they're not getting vitamin A in their food. And again, a lot of this is people, the very, very poor, that are living on just one food type. It may be just a grain or a rice, or, very, very low intakes of the vegetables that can, carrots are
Yes.
very high in vitamin A, and broccoli and the dark green vegetables. But, those don't grow in a desert very well. And
Yes.
so desert countries have a problem. South Africans have a problem.
Mm-hmm.
And they can't go to the grocery store and buy vegetables. So children are literally going blind because we're not getting the vitamins and nutrients in the food they need to be healthy.
Wow.
Yeah.
Super.
I mean, we don't realize how good we've got it.
Mm. Most of the people do not realize, actually. Excellent insights, Dr. Bob, right? So you recommend taking vitamin D during when the
Yeah,
sun
if you're not going to be in the sun, if it's wintertime and the clouds are covering, you should be taking vitamin D supplements. If you don't have access to the vitamin A, foods, the carrots and the green vegetables, you should be taking vitamin A supplements. And in adults, it starts showing up as night blindness. You're driving your car and going, why do I feel so blind, so hard to read the signs at night? Well, probably because your vitamin A level is low. You're not getting enough of those foods that you need. And that happens even in the most modern societies. People say, oh, I don't like that food. Well, eat your broccoli anyway. Find a carrot, eat it. When you boil your carrots so they're soft and squishy, you drink the water, because that's where the vitamin A is.
Absolutely. And you recommend, Dr. Bob, taking vitamin B12 for vegetarians, right?
Say that again?
You recommend taking vitamin B12 if you're a vegetarian?
Oh, absolutely. Or a regular alcohol drinker. You need to take B12 and get a shot or take it under the tongue, because just popping the pills doesn't work very well.
Spot on, Dr. Bob. Thank you very much. And yes, and let's talk a bit about dermatology and an interesting story in Swords and Saints. But before anything, I want to tell all of you who are watching this podcast, if you have not read this book, Swords and Saints, please go ahead and get it. It's available on Amazon Kindle, right? That's the book. And trust me, it's a book like you have never read before, because it's an easy to read book with small chapters in that book, and it tells you very, very interesting stories. I mean, it's common sense. Like sometimes people don't think about it, but it's very common sense. So it can save your life, right? You go to a place where you're doing something on an NGO project or something, and that book, if you know there is no doctor close by, just take that book, okay? Because that has over 3 decades of experience shared in that book.
And so it's also on audiobook. So when you're traveling by airplanes, you can listen to it.
There you go. The audiobook is also out. So
you wanted me to tell the story of eczema because it's a food-related story. And it's hard to imagine 30 years ago when I was doing residency training that we were this dumb in medicine. But we learn medicine has been advancing every year. And I was a young resident, and I was taking care of a brand newborn baby of an African-American mother, and he was covered head to toe with this dry, itchy, oozy rash, scratching, crying. And I had seen this many times, and always in my black babies. And I was frustrated. I didn't know what to do. And I was so lucky that on that particular day, my teacher was a black pediatrician who had paid very close attention to these rashes in pigmented children. And she said, "Hey, come here, shh, whisper. I want to tell you something." I went, "Okay, what?" "The baby's allergic to the protein in milk." I went, "Okay, why are we whispering?" She goes, "This is America. Milk is a government-funded program. We're not supposed to say bad things about milk." I went, "You got to be kidding me." And she said, "Just go back and ask the mother when she stopped breastfeeding and when she started milk formula, and you'll find out that baby's rash started as soon as she added milk in his diet." And I went back, and she said, "Yeah, this rash started 2 months ago. That's when I stopped breastfeeding." I went, "Oh my goodness." And within a month, by just putting him on a soy formula, baby's rash was completely cleared up, all gone. And I see it in all ages. You kind of outgrow the allergy because you build tolerances to most allergic reactions to foods, but it's the protein in milk that a huge percentage of the population of the world are allergic because their ancestors didn't drink milk.
Correct.
Now, the side story, also in my book, very interesting story. I was fixing all these babies. I became known as, the doctor who cures rashes. And I had a mommy make an appointment with me. They'd just come back from Panama, where they'd been for 2 years. And this 6-year-old child was covered with this scratchy rash. He's itching. He's miserable all the time. And they tried every lotion in the world, and it wasn't getting better. And brought him to me, and I was able to make the diagnosis almost immediately by looking at the rash, because it wasn't an eczema type rash. It wasn't an allergic type rash. There were things going on in between the digits of the fingers that is almost never seen unless you've been infected with lice, body lice. And when he was in Panama, he'd gotten these chiggers, and what chiggers do is they burrow under the skin and they lay eggs, poop in the hole, don't like it, get up, move, and do it again somewhere else. And they're so small you can't see them. And so you look at this child, and you could see the bite marks in a line. The bite, move, bite, move, bite, move. And I said, "Ma'am, this is going to be really easy to fix. Here's a cream. It's basically an insecticide. Put it on your baby tonight, wash it off in the morning, do it again in a week. And, 1 month later, that child came running up the stairs and grabbed me around the legs and gave me the best hug I ever had as a pediatrician, going, thank you. 2 years, the poor boy had suffered because nobody thought to look. They just said, oh, it's eczema, which is everybody's, diagnosis of exclusion. But it wasn't the food, it was the bugs.
Wow.
Yeah.
Pretty interesting. Pretty interesting. And another thing is like, how important is it to pay attention to your body and any changes?
This is a really good question. If anybody takes anything from this talk, remember that question and the answer to it. Even little things matter. It's so important for you to tell your doctors that, oh, by the way, something different is going on. For example, I don't sleep as well at night. Well, you have a vitamin A deficiency, or I'm getting swelling in my legs,
Yeah.
well, you have beriberi, or my migraines are worse because you're not taking your vitamin B6. Over the years, I've taught residents that are doctors in training and worked with other doctors in my clinics. And, I've told them, we have 15 minutes with a patient.
Okay.
And almost always, the most important thing that's going to be said by that patient is the last sentence they say as they're walking out the door when they turn around and go, oh, by the way, doctor, I forgot to tell you something. Stop right there, pay attention, because that's going to be the night blindness, headaches, little bit of a rash, the little thing that they didn't think was significant that'll tell you what's really going on. And so often it's almost laughable. I tell my doctors in training, what's the most important thing a patient can say? I tell her, the answer to that is, oh, by the way, something I forgot to tell you. But it's I want you to pay attention to things like changes in your bowel habits, color of your urine. If you see, blood when you cough, that could be cancer. Blood stool can be cancer. Changes in your urine, particularly in smokers. A lot of people don't realize this, but bladder cancer is almost always seen in smokers. Nobody ever seems to get it except smokers, but they're the ones they'll pee a little bit of blood and go, I should have mentioned to you there was some blood in my urine. Bingo, we got to go looking for bladder cancer.
Wow.
Your nails change colors and they crack and they grow differently. I want to know about it. The fungal infections can get in the toenails easily, particularly if you don't have good nutrition. And there's two types of hair loss. Mine, which just makes me handsomer, or these patches of hair loss where you get a hole in your head right there. There's no hair. Now that is called alopecia areata, and that is caused by stress. And so people when they're under a lot of high stress, they're not eating right, they're not taking vitamins, they're not sleeping, their body's going into overdrive. And what'll happen is they'll start getting clumps of hair coming out. That could also be thyroid or any other reasons that are nutritional to do that. But sometimes they'll get hair loss and white patches of the skin. And you'll see Black people particularly, very noticeable when they get white patches of skin because the contrast is so big. As soon as I see the patient, I'm going to check their thyroid first. Because that is an autoimmune reaction that we see very commonly for people that have gotten certain virus illnesses that attack the thyroid. And when they do that, it also attacks the skin. And if we catch it early, we can stop the white patches from getting bigger and worse.
Wow.
That's a great question. Pay attention to your body. Tell your doctor about the little changes. Good things will come of it.
Spot on. Thank you, Dr. Bob, for doing this wonderful episode with us. And final message to all the Dr. Robert Adams, aka Dr. Bob fans around the world.
The final message is, my favorite doctor is Dr. Google. If you've got internet access and you're wondering what's going on, go on Google and put those symptoms in there and see where it takes you. And more often than not, you're going to find out what's going on and you can come tell your doctor and he can fix it. So don't, you can forget Dr. Adams, but don't forget Dr. Google.
So I'm sure Dr. Adams will not be forgotten with these special episodes which we have done, and many more will continue to come, right? So you don't have access. Okay, if you don't trust Google at times, don't forget to watch our episodes. Still, you can learn. And please, if you have not bought the book, Swords and Saints, just go ahead and purchase it. It doesn't matter whichever part in the world you are watching this from. It's available on Amazon Kindle, right? And it's for a lifetime.
Yes.
Right. So thank you once again, Dr. Bob, for doing these episodes. And we'll see you all on the next episode, the importance of sleep.